India is in the midst of a massive national vaccination rollout program. Multiple questions still swirl about the safety and the efficacy of the vaccines that are being administered. Questions also about how we can scale up the speed at which these vaccines are being rolled out. To talk about all the questions that have been swirling around the manner in which vaccines are being rolled out and what happens from here, we want to go across live and exclusive on the India Today network. We're joined at this time by the Chief Executive of Serum Institute, Adar Poonawalla, the man who's responsible for the vast majority of the vaccines being rolled out in our country. Mr. Poonawalla, welcome to India Today. I want to ask straight up the question about the safety and efficacy of the AstraZeneca vaccine. Yours is a vaccine very similar to the one that in Europe at this moment finds itself in the eye of a storm. I'm reading an article on Daily Mail where you've got UK regulators, Marco Calaveri, who's the head of vaccines, now alleging that there's a link between the jab and blood clots. Now, this is a question that people have in their minds, and I want you as the manufacturer of this vaccine in India to respond to this entire controversy with the European Medicine Agency saying that they are baffled about how the vaccine being given by AstraZeneca is potentially leading to blood clots in people in Europe. How do you respond to this? Adar Poonawalla, welcome.
So thank you, Rahul. You know, I've stayed silent intentionally for the last 2 months on a number of issues because we don't want to unnecessarily cause headlines. And I think the silence was deafening, as they say, because of so many questions, you know, in the public domain that remain unanswered. And I suppose somebody has to answer them. From our point of view, this vaccine, from the time it was in its clinical stages, was associated with different levels of efficacy, neurological issues, and now this business of blood clots. What I always maintained is that let the investigators and regulators investigate the matters and then come to their logical conclusions instead of, you know, going by what, you know, is being said in the media or what manufacturers claim is happening. So what we saw that the Ministry of Health in India, the WHO, the EMEA and other countries have said that this vaccine is perfectly safe. In fact, even with this recent matter of blood clots, I never wanted to make a statement because next week you're going to hear the conclusion to what is happening and we should wait for that. Because what really needs to be established in any adverse reactions or other severe adverse events, as they're known as, that is there a cause and a link, and is it statistically significant where the risks outweigh the benefits? Certainly here, the quantum of blood clots that have happened, we have to still establish and see if it's vaccine related based on the fact that, you know, blood clots is a normal phenomena in a given population of age and comorbidities. So we have to see whether the vaccinated group of people in these countries have found a higher incidence of blood clots compared to those that aren't. And is that even statistically significant? That is your starting point. Then you have to go into establishing whether there's a link between the two, because there still could be many factors. So let's wait and see what happens. So far, we've seen that there's no issue like that here associated with the vaccine. The vaccine is providing excellent safety and efficacy. Everybody I talk to, and we've seen that with their own public announcements. In fact, the real testament is that everyone who's been vaccinated, not even 2 or 3% of those people who have got COVID-19 have had to be hospitalized. So we're seeing that 90 plus, 94% plus efficacy with even one dose of Covishield in India, which is actually validating what was seen in Scotland Public Health with their study that they've done, which will be published in Lancet and is already on their website, which has happened in more than 400,000 people as a study with one dose.
So how are you perceiving this idea of vaccine hesitancy? Do you think we've been able to alleviate people's concerns adequately? Because as people read international journals, they read what's happening in Europe, they wonder if it's the same vaccine that Adar is producing, which is being sold in Europe and is now being banned by some countries, and they've paused the rollout of the vaccine. Is that reason then for them to be concerned? That's the concern most people have in their minds, Mr. Poonawalla.
No, absolutely. And these are legitimate concerns, because if you're reading all these things, you don't know what to think and what to expect. All I can say is that if you've seen all the countries, including Germany, that has banned AstraZeneca, Oxford, right, and other countries, have reinstated them. So these are not bans, they're temporary reviews of safety and efficacy, after which, and that's the right way of doing it, those regulators have continued things going, including the EMEA has not suspended or banned Oxford AstraZeneca. WHO has said it's safe and should be used. EMEA has said it, and the UK MHRA has said it. Now, they can't all be wrong, including the Health Ministry of India, who has analyzed and looked at, more than 100 million doses that Serum has delivered to India, right? And I think 7 crore doses, jabs have entered human beings in India. We've not seen anything serious that we should be worried about. But, it's a good thing that countries review what's happening for everybody's sake and safety. And then they, after investigating it, reinstate the emergency use license.
The other question that's come to us very often is about people who are potentially prone to having autoimmune disorders. People have messaged us saying that their fathers or people that they knew who after taking the jab suddenly had a bout of an autoimmune disorder. Now, can you be transparent and tell us, are you hearing of this? Are you concerned about this? How do people who may be prone to autoimmune disorder deal with the idea whether they should get vaccinated or not?
Firstly, this is a question for a doctor to answer. It wouldn't be my place to, give free medical advice based on conditions of patients that I have not even seen or treated. But what I can say is that, look, all vaccines traditionally will not enhance or be detrimental to, people in those conditions, unless they have certain conditions where they, have a problem with their immune system, which can't make antibodies and respond to a vaccine in the same way in which they can't respond and make antibodies to a genuine virus that has infiltrated their system. Their immune system is compromised because they have these disorders, or, for example, if they're taking drugs for cancer patients to suppress their immune systems. So naturally, the vaccines are not going to be so effective in their cases. Now, does it enhance their disorders? Does it have safety issues? I don't know. It could not. I just would not be in the position to answer such a question. It wouldn't be right for me to answer. But yes, I would definitely say that those patients who are on those drugs and or have those autoimmune disorders may not respond as well to the vaccine as a healthy individual like you or I might do. So that's all I can say on that.
What do you make of the vaccination rollout process that India has seen so far? Multiple questions now being asked about whether we should allow for universal adult vaccination, whether they should be taken out of government control, whether we've reached a stage where companies such as yours should be allowed to sell the vaccine directly to people out in hospitals or at pharmacies who can go out and buy their dose and then administer it without having to go through the government system.
Well, that's possibly the most difficult question for any government to address or answer, or even a manufacturer, because on one side, you have this global dependence on the Indian vaccine industry to supply. On the other side, you're seeing a surge of cases in India. So right now we are, and rightly so, prioritizing the needs of India and giving all our supplies to India, much to the displeasure and discontent of all the other world leaders who are disappointed in Serum Institute or not being able to fulfill their contractual obligations. But we're here to serve our nation first, and that's what we're doing for a temporary period. Remember, this is not forever. And secondly, to answer your question on whether it should be freely available to different age groups, private sector, etc. That again is a little tricky because on the one hand, we're seeing this crunch and shortage of supply. And if we open up to every section, to all age groups, the vulnerable may suffer in that. And that's just to take the statement made by Health Secretary Rajesh Bhushan, that is why it's not such an easy decision to just open it up below the age of 45. Now, there is an argument that, if other countries are able to do it, why can't we? But the point here is our population can't be compared with other countries. So whilst I'm not defending anyone's decision, I'm just saying it's a very tricky and difficult position everybody is in today, where there's really no right or wrong answer. Should it be opened up to the private market for corporates to also buy the product and not? I mean, from my point of view, yes. But from the government and the poor individuals' point of view, perhaps not, because the government today has to balance out the interests and needs of the lower, middle, and upper class.
So you're in constant conversation with multiple stakeholders in government, both ministers and bureaucrats. What's your best sense at this moment, Adar Poonawalla, about how soon will your vaccine and other vaccines be available in the private market in India? How soon do you see that happen? We're in the beginning of April. Will it happen by the end of this month? Do you think it will require more time? What kind of timelines are you anticipating?
So I'll tell you what I've explained to the government, and they understand this given this situation. By not opening it up to the private market, we protect the vulnerable and give the priority-based vaccinations. Now, that is good for India and the people of India, perhaps not so good for the vaccine industry, which hopes to make a reasonable profit and return to innovate further, ramp up capacities, and kind of earn the revenues that foreign companies can do. But however, we are working with the government at this stage, at this price point, at this supply point, to take care of Indians first. That is, after all, our priority and responsibility. So, to answer your question, for a temporary period of 2 to 3 months, we have fully accepted the request from the Modi government to maintain this price and to prioritize the supplies to India. Now, if it's for a temporary period of time, that's okay. The vaccine industry has enough time to make its profits in the next few months and export obligations, etc., etc. However, we hope that it is a temporary period of time, because then it's not so good for everybody. So this is the service that we are providing as a vaccine industry to the nation in this time of crisis. And to answer your second part of your question, we will see a major ramp up of serums facilities and other vaccine producers from the month of June onwards. Until then, we're going to see the kind of volumes that we're seeing today.
No, so explain that to me. At this moment, how many vaccines are you producing every hour, every day, every month? When I spoke to you last, this was after the unfortunate fire in one of the serum facilities in Pune. At that time, you said that this fire will not have any impact on the production of Covishield vaccines for COVID-19. Later, I saw you being quoted as saying that because of that fire, some of the production plans have indeed been impacted. So what impact did the fire have on your production process? How many vaccines are you producing at this moment, Adar?
So let me clarify. When I said the fire will not have an impact on the production capacities, that is still an accurate statement, because that was pertaining to the existing facilities. For the ramp up and to induct new facilities and filling lines, that is what got pushed back by 2 months. So we were making 4 to 5 crore doses a month in January. Now we're making 6 to 6.5 crore doses on a monthly basis from this month. This was the plan and what we could get out of the existing buildings that we dedicated to COVID, which was not impacted by the fire. Later on, we explained to everybody that the ramp up and expansion plans, which we hoped would be available by the end of April in terms of supply, or May even, has now been pushed back till the end of June because the additional filling line did get damaged in the fire. And so, it's not a total write-off, it's just a delay of 2 months. And we were very lucky. Otherwise, the new additional facilities that we're planning to bring online with the government's help, and we've submitted a proposal for aid from them. And if we don't get it from them, we'll still remain committed and go to the banks. That plan has been pushed back by 2 months. So that, I hope, clarifies, the statement I made about the fire, which happened on the 21st, sadly, of January.
So, from what I understood of what you just said, you're producing 6 crore doses. So this is 6 crore vials or 6 crore doses? Because each vial has 10. Yeah. So 6 crore doses of the COVID vaccine at this moment, and you hope to scale up significantly by June. When you say scale up significantly, this 6 crore will become how much in every month?
10 to maybe 11 crores on a monthly basis. So it's like, almost a 40% increase.
You've also stopped sending supplies abroad. That's got you some bad press internationally because there were commitments. Now questions being asked about why those commitments are being reneged on. How do you view many Indians, who say when it comes to terrorism, when it comes to the flag, when it comes to various other issues, we're very nationalistic. Suddenly when it comes to the vaccine, we believe that, you want to have this big vaccine Maitri project and have the vaccine shipped elsewhere. It's a very tough question. How do you see this play itself out? Because most people who are watching you on India Today this moment will say, yes, we love the rest of the world, Vasudev Kutumbakam and all of that, but let's just ensure that our most needy people get vaccinated first, which is what the rest of the world is doing. So no one can really blame India for being selfish or thinking of its interests first. That's just the way the entire world is playing itself out right now.
Absolutely. In fact, I don't blame the Indian people at all to expect all the vaccines to come to India first, because if you look at what's happened in Europe, Europe also has banned or temporarily suspended, so to speak. We've not banned exports. We have prioritized our country for the next 2 months. Whereas Europe, US, they've banned exports of raw materials and vaccines, which is impacting other vaccine producers. I publicly said that the US needs to have a global perspective and, not ban raw materials. They might as well be banning their vaccines from being exported, because by banning certain raw materials, companies like myself and many others will not be able to scale up to the extent that we would want to. Fortunately enough, the US ban of raw materials is not affecting Covishield, but it's going to affect Covovax, which is the Novavax candidate, which I'm hoping to start stockpiling from next week, going on for another few months until licensure.
So let me put that question to you further and have you elaborate on when your second vaccine, because when I came to the Serum Institute facility, there were 2 sets of COVID vaccine that you were working on. Covishield is already out in the market. Covovax is the second vaccine that you're working on. What is the status of that vaccine at this moment? How soon will it be available for public consumption in India? And what is the difference between your second candidate and Covishield, about which we now know more?
So in January, I think when we had this discussion, we were applying to the regulator in India to start the bridging study of Covovax, just like what we did for Covishield. Similar size bridging study with, the vaccine arm and the other comparator and others. So to do an immunogenicity bridging study. Now, that went a little bit up and down and had some delays, in getting the permission going and discussions that we were having, because we wanted to get it right. We didn't want to start a trial and then have issues. So that has finally now started, as I publicly announced. And hopefully by September, maybe October at the latest, we hope to get licensure in India. That's where we are at the moment. And we will start to stockpiling some vaccines like we did for Covishield ahead of time. To answer your second part, the global efficacy trials of Novavax have shown 89% efficacy overall, and also good efficacy, and I don't know exactly how much, maybe 50 to 60% against, the South African and the UK variants, maybe a little bit better against the UK variant as well. But let me tell you, both Covovax and Covishield, at the cost of repetition, has more than 94 to 95% efficacy against hospitalizations. In fact, in some countries, it is 100% effective against hospitalizations, which again means to the layman that 100% of people who took the vaccine never had to set foot in a hospital when they contracted COVID disease.
Okay, so now the one big concern is about these mutations. We are hearing from authorities in Punjab that the UK strain has come there. You're based out of Mumbai and Pune. We're seeing a wild surge of cases across the state in Maharashtra, not just in Mumbai and Pune, but in more rural or semi-urban areas as well, or at least towns outside the mega cities. How concerned are you about the efficacy of Covishield against the new strains of the COVID virus?
So that study is ongoing in the sense that we are observing, as you mentioned, this UK variant, which has now started to really spread in our country. And we're already getting data of the people who have taken Covishield, 1 dose and now some of them 2 doses, who have got the UK variant, because with genomics you can tell whether it's the UK one, Wuhan, whatever. And I think if you ask me this question in a month, we would have a real picture of thousands of people who have got the contrived the UK variant disease, who have already been vaccinated and hopefully not had to enter hospitals.
No, so let me press you further on this. Adar Poonawalla, I want to press you further. Essentially what you're saying is that you may not end up in hospital, but you are accepting that the level of efficacy of your vaccines against the UK or the South African strain is lesser than the original strain which we were dealing with earlier.
Let me rephrase. No vaccine, whether it's Pfizer, Moderna, Oxford, AstraZeneca, is preventing more than 20-30% of the people who get it or are exposed to COVID-19 from getting the disease. They experience mild to moderate disease. So there is no vaccine, sadly, on the planet today for COVID-19 that prevents the person getting the disease. In some cases, yes, it does prevent it if it's not a heavy infection. But in most cases, we've seen you've got Covishield or the Pfizer vaccine or so many other vaccines globally, you still get the disease, but 95% of the time you don't go to the hospital. Now, hopefully, we're going to see this trend continue even for the UK variants and for the South African variants. So far, what I can say with confidence is I have not seen anyone getting the UK variant disease who has been vaccinated and still ending up in hospital. So far, that is the silver lining. But to conclude this beyond reasonable doubt, we should wait at least another month or two till we see enough people getting the UK variant as a disease who have been vaccinated and then observing how severe the disease progresses in their body. Now, that's when we can really conclude beyond reasonable doubt that these vaccines today are able to protect against these variants.
I don't know if you've seen, but there's a video clip of yours that's gone viral, which is from a past interview that we've done with you about the period between the 2 doses, where you'd said that the maximum efficacy is on the back of a gap of 12 weeks. At that point in time in India, the gap between the 2 doses was supposed to be 28 days. Now the government has increased that further to 6 to 8 weeks. At this moment, Adar Poonawalla, on the back of all the data that you have access to, how much should be the ideal gap between dose 1 and dose 2?
You're putting me in an awkward spot, but I'll try to answer it as correctly as I can. Now, the data globally has proof that the longer the period, and this was proven in the trials that we all knew, sadly, it was communicated in a slightly confusing manner, and that's why there was all that doubt. Most vaccines, the longer gap you keep, it gets your body an opportunity to develop antibodies in a different way, and you don't block yourself from the first shot. I could explain this in detail, but perhaps not today on this show. The point here I'm trying to make, I stand by that statement. And as the Indian regulator sees more data and it wouldn't be fair for me to make a statement and then say, oh, why is the Indian regulator not doing it? They need to see the data coming about, which they are, and that is why, you know, the committees that decide on these things, rightly so, increase the gap, you know, from the original gap that you mentioned was there between 4 weeks and now it's 8 weeks. And we're slowly, as we get more data in India as well and other places, going toward that 3-month gap that I had originally hoped that we would have here as well. But we're moving toward that in that direction.
So just to
that's as best as I can answer that.
rephrase what you've told our viewers in a very diplomatic way, Adar Poonawalla essentially suggesting that the ideal gap from his perspective between dose 1 and dose 2 is 3 months, even though the government's moved it up to 6 to 8 weeks from the 28 days.
And they're moving in that direction.
Sure.
They're moving slowly with data, which is the right way. Look, I mean, tomorrow, anyone, any manufacturer, or anyone may say, you know, this is the way it should be. But we must respect our regulator who wants to go on data and proof and evidence.
Sure. So we've had cases, Adar Poonawalla, in our office where people got vaccinated and subsequently they ended up with COVID. Now, when that happens, people wonder, you know, so you said that it will take about 15 days for immunity to start building. By 28 days, you have strong immunity, about 70% immunity is already built up. Now, a month has passed since these people took the dose and yet they end up COVID positive. And when that happens, everybody else wonders, hey, is Adar's vaccine working at all?
Very good. I'm so happy you asked that. So as I explained earlier, that's why I called it COVID Shield. It's not a bulletproof vest. Imagine if you're shot with a gun, the bullet, when it hits your bulletproof vest that is supposed to protect you and save your life, is only a shield. It's still going to cause you some damage, bruising, maybe you might even break a rib, right? But you are not going to die. And hopefully that is the case, and that is now being shown as an evidence. And what is that? It protects you against severe disease, which can threaten your life 94, 95% of the time, even after one dose, right? And you can look at the data which is coming out with Covishield will give you that protection. In fact, today, everyone from the time January to now, and now we've spent 3 months, you know, you've got, I don't know how many crore people, more than 4 or 5 crore Indians that have received one dose. Let us now observe and see that are they being hospitalized or not?
No, is that not a changing of the goalpost? Because isn't the original idea of vaccination that this immunity booster builds up immunity in a way that you can ward off the infection, which means that the infection doesn't come to you? Now, you're seeming to suggest that you may not be able to push back the infection, it will still come and get you, but it will ensure you don't die or don't end up in hospital. Is that not a changing of the goalpost, sir?
Absolutely not. I'll tell you why. Neither did I or anybody claim ever that any vaccine will prevent you from getting the disease and passing it on. Maybe it was a hopeful assumption from the public, or maybe that's what we all were praying for. But even if you look at other vaccines today, vaccines against pneumonia, rotavirus, so many others, very, very few vaccines will prevent getting the disease and transmission. You will be okay, right? And that is why it is essential that everyone gets vaccinated. You see, this was the whole message from WHO and everybody else. If you look at even the data and claims from all other vaccine manufacturers, not just for COVID vaccines, you show me there are very few vaccines in the world that prevent complete, you know, disease penetration and transmission. I mean, imagine a virus is going into your system when you inhale it from someone else. That virus is going to multiply to a certain extent in your body. You will develop symptoms for it. But the fact is that if you've taken the vaccine, you've got ready-made antibodies and a T-cell response, which will take care of that virus so quickly that you will not let that disease progress in your system to then be hospitalized. And that hypothesis and theory is now being proven in actual fact and evidence as we see, touch wood, a lot of people getting the vaccine and not having to go to the hospital. And I hope that that trend continues with these other mutant variants. That's the only question mark that remains. But this goalpost has never been a goalpost. I've never said it. I don't think anybody else has said it from the scientific community. Maybe some people have assumed it or hoped for it, but that certainly is sadly not going to be the case.
Finally,
so It'll be a shield, it'll be a COVID shield, but there's nothing which is really bulletproof. In fact, if you look at all the drugs out there, whether it's antibiotics, whether it's so many other drugs, some of the time they just don't work to cure you. So nothing today created by man is 100%. It works most of the time, but not all the time. That's the point here, sadly.
Finally, I have young children, and we're keen that they go back to school, as I'm sure are many parents. We're wondering if you've started trials on young children. Is there any way of knowing whether your vaccine is efficacious even against young children? What age do you think is the youngest a child can be administered your vaccine?
So we're going down to the age of 12 and maybe even lower than that. That's happening in the UK at the moment. We don't know if we'll have to do another trial, to show some safety in India. We might. We haven't applied to the regulator yet. I would guesstimate a 6-month time period for Covishield to be approved and proven to be safe in children below the age of 18, going down to maybe, 10 or 12 years of age. And then maybe later on, eventually after a year, even lower than that. But you see, when it comes to children, we want to be very, very sure in the dosage, in the safety, the way the vaccine replicates in the system. The children's metabolism and immune system is very different to an adult. So we need to go very, very carefully there. We don't want to take even a 1% chance of harming a child, in these trials. So that's why it's taking a little bit longer.
How long will immunity last after the 2 doses have been completed? Will there be a requirement for a booster dose a few months later? How many months would that be?
So I know already some other vaccine manufacturers are proposing a 3rd dose and doing trials to prove how much better that makes things. We are looking at it because at the moment, the data we have, that minimum 7 to 8 months protection with the 2 doses, after the 2 doses are administered, is there. Now we have that data coming out globally. They'll publish it soon. So we know that for certain. Now, after 8 months, we don't know because the time hasn't passed. The real way of proving that, is, waiting for that period to pass. So we've got data from the Oxford AstraZeneca vaccine from the very early patients and trial candidates and others that were vaccinated, 7-8 months ago. So we're waiting to really know and answer that question as time goes on. Whether a booster is even required or not, maybe yes, after maybe a year or so, something like that.
Adar Poonawalla, you've been the cynosure of all eyes over the past several weeks. 60 million doses being produced at your facilities in comparison with 4 million at your competitors. That's the gap. So, about 95% of the people getting doses at this moment are likely to be getting one of the vials coming out of your facility. How have these few months been for you? Individually, institutionally, for your family and for the team at Serum?
Stressful would be an understatement because it wasn't just the stress, it was the uncertainty and unpredictability of every week throwing new challenges, issues, whether it's a lawsuit, whether it's some controversy on the product, whether it's some permission, whether it's an issue of the raw materials, working till late hours of the night on conference calls, that challenge and that work that the entire team and my family went through for the last year, I would not wish it upon anybody. And I just hope that we as a community, as an industry, are better prepared in the future. And we've learned so many lessons that we'll be better prepared for this kind of situation going forward. And I'm just so relieved that things have now worked out so well after all the risks we took early on, for which we're able to do this today. And every employee is just so happy and proud, but still under tremendous stress, don't forget, because even one batch failure or one issue with the manufacturing facilities, could be detrimental to the India supply, to the global supply. So that stress level is, still up there. even today, and it continues with all these new candidates. So, whilst we wait for all this to be over, there's also a moment of relief and satisfaction and gratification that we have, that we've been able to deliver this to our nation and to the world. And, we're thankful to the government and everyone who's played a role in helping us get there, including the public that has been extremely understanding and patient with all this stuff that's been going on.
Are there any problems you're having in procuring vials or raw material around which you want there be public pressure so that, whatever can be done, which needs to be done to scale up production happens as fast as possible, Mr. Poonawalla?
That is ongoing. I mean, I wish I could go there and protest in the US myself to say that you are holding back critical raw materials that are required for Covovax and so many other vaccine manufacturers in India and other parts of the world. That is one thing we're really struggling with in the short term, because we need this now. We don't need it after 6 months or a year, because by then we'll have developed other suppliers, all these critical media, and because we don't want to be importing things from China and other places where there could be quality issues or other supply constraints. We want to get the best quality raw materials, and at least Serum Institute and other vaccine manufacturers in India will not compromise on quality. And that is why we're so dependent on certain raw materials for our vaccines. And that is one thing that is an ongoing challenge and dialogue with the US and other countries which have invoked this Defense Act, which is a bit draconian. It's like banning vaccines or whatever, from the US going to other countries. So we're doing what we can. Even the government of India is helping or trying to explain this to the government in the US to be able to relax these raw material shipments.
Okay, we wish you all the best. It's been good having you back on our network after several weeks. Thank you very much for your time. Multiple questions have been answered by Adar Poonawalla, and I hope that they give you something to wrap your heads around, because we're getting so many queries. We channel them to the CEO of Serum Institute, and hopefully you got some answers that you've been wanting to know about. Thank you so much, Mr. Poonawalla, for joining us on the Newstrack.
Thank you. Good to be with you.
This is where we slip into a very quick break. I hope you enjoyed that conversation. We'll have more for you when we come back on the other side. Stay with us. You're watching India Today. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.